because you represent communities that are historically oppressed, historically marginalized, historically thought about when they think about us at all last. And so I want to remind you that this is not the biggest pandemic in my career as a physician. The biggest pandemic in my career as a physician has been the HIV/AIDS pandemic. Yesterday was World AIDS Day. This pandemic has been with us for 40 years. And the infection rate among Blacks, for example, and other people of color today, when we have medications that not only prevent people from dying, unlike 40 years ago, and prevent people from transmitting HIV through sex, unlike 40 years ago, the infection rate today among poor people and people of color is higher than it was among gay white men at the height of their experience with this pandemic. So just because we make great progress, which we've certainly made medically with HIV, doesn't mean that for our communities the problem is solved. It doesn't mean that. And so we should ask ourselves, we have COVID now. Where are we going to be in 5 years or 10 years? Or are we going to be 40 years from now still talking about differential death rates in Black and brown communities from COVID? And that's why we need you to be on this early. That to me is one of the greatest things about the fact that you all have agreed to step forward with your organizations and help public health with this important effort. And your input is critical to making sure that what's happened with HIV doesn't get repeated with COVID.